Hello and welcome to your favorite program on Clearview Television, You and Your Health. Today we'll be talking about ulcer and everything you just need to know about this disease. And guess what? We have in the studio with us our very own good friend, Dr. Karen Oguma. You're welcome to the studio.
Thank you so much.
It's good to have you. You look sharp today.
Thank you.
Tell me, how did you do it? Because
makeup, eat well,
okay.
Drink right.
All right. Okay. She said something. She said make up, eat right, do everything
Drink
right.
yes, sleep well.
All right. It's good to have you.
Thank you so much.
Nana, I said we were talking about ulcer.
Yes.
What is ulcer generally?
Well, ulcer is a wound. That's what it is, right? So if you, what we're supposed to talk about, what we are talking about today is peptic ulcer, because if you talk about ulcer generally, it's like wound anywhere, like wound on your leg or your hand, but today we are talking about ulcers in the stomach. So peptic ulcer disease is a sore or a wound in the lining of the stomach. You know, the stomach has different layers, right? So the inner layer of the stomach, that when you have a wound on that inner layer, that is what they call peptic ulcer. But it can be it's actually a wound on the digestive tract. So it can be on the esophagus, you call it esophageal ulcer. It can be on the stomach itself, we call it gastric ulcer, or it can be on the small intestine, the duodenum, we call it duodenal ulcer. So it's any along that track. And what causes it is when the gastric juices, that's the acid in the stomach, begins to digest the lining of that digestive system.
Having said that, I was actually going to say, like you said, a wound in the stomach, because a lot of people, like me, I'm not a medical doctor. I was going to ask you what really caused this wound in the stomach, and you've rightly answered.
That's just the mechanism of action. There are other causes, but the general thing is what happens is the acid corrodes. We can now talk about what could make this acid go beyond the level that it should be, or what could make this acid stop acting, you know, the way it should act, and then start corroding the stomach lining. So if you want me to talk about that, we have the one organism, a bacteria they call Helicobacter pylori. Short form is H. pylori.
Okay.
The bacteria produces some what will I call it now? Is it some enzyme they call urease that reduces the acidity of the stomach acid. So the body is now forced to produce more acid. That's in, like now, you have, how will I say it? You have water in a cup, and it's at a particular level, and then something comes and starts reducing it. The body now tells the body that this water is not enough, so it tends to produce more, and in producing more, it becomes excess. So that's one cause. Another cause is what the painkillers. Painkillers you take for headache, for body pain. Old parents that are treating arthritis and everything. Sometimes some people even have the ulcer pain and they are taking painkillers, so it worsens it. So painkillers like ibuprofen, Feldin, diclofenac, Voltaren. Voltaren is diclofenac. I'm just saying both generic name and brand name, because when you go to the chemist, you hear all of them. So Voltaren, diclofenac, any NSAIDs can cause ulcer. Another brand of drug that can cause ulcer or worsen it is chronic use of steroids. So when you find people on prednisolone for a long time, oral prednisolone, it can cause ulcer as well. Then you have some other causes. You have genetic causes. You say this, it runs in the family, kind of, you know.
Now, before you go on, of course, you come back to that. You know, talking about drugs that can actually cause ulcer in the human body, especially in the stomach.
Yes.
And then you talked about painkillers and all of that. And sometimes when you go to the hospital, the doctors tend to prescribe some of these drugs for you, which you don't know. And after use, it might also result to this kind of sicknesses.
Yes.
And of course, you are not a medical practitioner,
you
will not know. How do one prevent this kind of
the
situation?
Doctors should actually tell the patient. That's why we have consultation. That's why you communicate during your consultation. The doctor should tell you that, hey madam, I'm giving you so and so drug. It can cause this. These are the side effects. You should take it with food, right? So if you take those drugs with food, it won't cause any problem for you unless you already have ulcer. It may aggravate it. What I tell my patients in the hospital is, madam, I'm giving you this and this and this drug. This particular one, you must take it with food, not 1 hour after you have eaten. Because if you tell patients take with food, they will say okay, then they will take it, they will remember, like I've eaten now. No, now remember, I didn't take my drug, let me go and take it. No, you will take it when you are eating. This particular one, every other one you can play with, but this one, if you don't take it, you will come back and I'll start treating you for ulcer. So they will know that it is serious. So you try, the doctor should try. You understand? So when you educate your patients very, very well, they don't, have such problems. And then you should also tell your ulcer patients, do not take this drug at all. When you go to the hospital, start shouting that I have ulcer, so that nobody will give you the drug.
All right, having said that, before I caught you, we're actually talking about more
Other
of causes of...
Yeah. So other causes could be, I talked about familiar causes, like it can run in the family. There are some people that says it runs in their families. And then some people have tried to link stress to ulcers, but there's been no direct link. So, but they say stress can worsen it. Like mental stress, you're stressed up, it can worsen it, but there's been no direct link per se. Another thing is starvation. If you starve yourself, the acid will just look for something to feed on, because what the acid actually does is digest your food. So if you don't eat on time, if you eat at the wrong time, let's say you're supposed to have breakfast by 8 and someone say I don't eat early. It happened to me. So I'm very, very serious about ulcer. Like I was a medical student and I used to eat breakfast at 10.
Whoa.
And it was like normal. Like you have to get to school first, take some lectures before you now go on break. So after one of those break times, as I finished my food, I landed in the hospital because the pain was so severe. It was too bad. I didn't even know what was wrong with me as a medical student then. So when you eat late, the acid is not going to say, okay, Karen is by 10 o'clock, let me wait for her before I start digesting. To start digesting the stomach linings, and it will cause a wound for you. So that's another cause. And then you have some syndromes where the body tends to produce excess acid, like Zollinka-Ellison syndrome. So that one is also another cause.
So the bottom line known is you eat properly and avoid starvation.
Eat at the right time. These people that say they are doing weight loss and they are starving themselves.
Okay.
Well, God will help all of us. Eat at the right time. Eat the right foods. And then you won't have ulcer, at least from starvation. Avoid those drugs. As per H. pylori, that's the organism. Well, you get it from food and water. So it's just the way you also try to prevent yourself from getting typhoid. You have to be careful. You can't do anything about it.
All right, having said that, let me just put myself in the shoes of those people watching from home right now.
Yeah.
Some persons will be wondering, is ulcer a communicable disease?
No, it's not. It's not at all. It's
so, like, you cannot get ulcer.
You can't get it from another person. No.
Okay. And that's good, because people like me, I was thinking, okay, maybe you
so if I touch you.
Okay, it could be. There are other means anyway. Okay. So, okay, having cleared that, ulcer is not a communicable disease. And then you've mentioned about, the types and kinds of ulcers that we have. What are the common symptoms? If I have an ulcer, I might not know. Or someone is suffering from ulcer, I might not know. And the person will go ahead and be treating another different disease altogether. Yeah. How does one know that, this is ulcer? What are the common symptoms?
The commonest symptom is stomach pain or abdominal pain, as we say. And it can start from, it can be, along the line of from the umbilicus up to the chest. Right? Because remember, I said there are different types. It can be esophageal, it can be gastric, and it can be duodenal. So it can be along that line, and it's painful. So, but what we try to, the way we try to differentiate this pain apart from this site is how does this pain feel? So you see people telling you that it is pepperish, it is burning, it is biting, that kind of pain. That's how they describe it. They rarely say it is sharp, but sometimes some people can say it is sharp. Some people can even tell you it is twisting me. You understand? But the commonest symptom is abdominal pain, burning, or pepperish. Sometimes they can tell you it's paining them to their back. Right? So that's another sign. That's the commonest and the the most classical one. Then you have others. Nausea, that's nausea is like feeling to throw up. Yeah.
Okay.
You have poor appetite. You have this abdominal pain. Sorry. Let me just go back. There are some people that their pain gets worse when they eat, and there are some people that their pain gets worse when they've not eaten. So it helps to also tell you which one is which. If your pain is worse after you've eaten, we tend to think that it's a gastric type, and if it is worse after eating, we tend to think it's before eating, we think it's the duodenal one. So it helps us to differentiate, right? Then other symptoms you may have, that's when the ulcer is now getting worse. You will now hear people saying their stools are dark. We call that melena stools. Or they start vomiting blood. You know that there is a complication. You can't do this by yourself. You can't be at home and be calling doctor on the phone. You have to get to the hospital as fast as possible. So those are the common symptoms that you have.
All right, now I know a lot of people are watching, and just like me, like I will say at every point, I'm not a medical practitioner.
Okay.
I'm just like every other person out there who maybe at one point you're suffering from this and you don't really know what's happening with you. And some persons, now you said something, one of the symptoms is abdominal pain. Does it mean any pain you have in the stomach it could be a sign of ulcer?
Upper stomach.
Okay.
The upper part of your stomach, yes. The lower part, it can, if you have pain lower abdomen, it can be urinary tract infection. It can be, if you're a female, it can be something in the ovaries, it can be appendix, it can be anything else. But upper part of the stomach, like this middle upper part, is most likely. Yeah.
Now, you've talked about some certain medications that can actually lead to ulcer.
Yeah.
And then who like among the young child and the adult, who is likely to contract ulcer?
Well, children they have their meals controlled. There's almost no child from a proper home that have the parents have money to feed, that doesn't eat breakfast before going to school and doesn't pack lunch box, come back and eat lunch or mid-lunch, whatever that is, and then have dinner. Most children eat 3 to 4 times a day. So it will be difficult for a child to have ulcer. Most children eat food schooled by their parents. It will also be difficult. But adults run out of the house early in the morning. They will not have breakfast. They get to work. They might eat something from anywhere, or they might eat biscuits, and that's not food, or whatever it is they can find. And they might eat it around 12 when they have time. So already they are starving. Already they are not eating right. Already they are eating from a place they shouldn't be eating from. And then you don't know when you're going to get home. So most adults eat 1 to 2 times a day. So of course, an adult is more likely to have ulcer than a child.
All right. And then having said that, how is ulcer diagnosed?
Well, there are different investigations that you can do to treat ulcer. When you come in, we don't just start from the highest investigations and start coming down. We go step by step. So the first and commonest test they do these days is H pylori test. So they send you to the lab, they take your blood and you do H pylori. Another way that we check for ulcers in Nigeria is fecal occult blood. You remember I said you might start passing blood in stools, but before it becomes frank blood or dark, they check if it is possible that there might be traces of blood already indicating that you're bleeding inside. And then the gold standard, the one that says yes, this is ulcer, is endoscopy. They pass a tube into your mouth to the stomach to see it, like, okay, yes, we have seen the ulcer and we've seen the organism. They might even take a sample of the ulcer to check and make sure that it is ulcer and not a malignant tumor going on there. And they might also take samples to make sure that, okay, let's see this organism and all that. So the gold standard is endoscopy. But how many Nigerians can afford endoscopy? How many hospitals have endoscopy? So many hospitals do the fecal occult blood and the H. pylori test.
All right. Having said all of that, what other ailments can trigger ulcer?
Many people that fall sick, most illnesses are stressful to the body. And remember, I said stress can cause ulcer for you. So I remember when one time I felt ill. I just started having peppery sensation, and I had to complain. Luckily, I'm a doctor, so I signaled on time and said, oh, please start treating this. So anything from surgeries, any illness, in fact, that can stress you, that can make you not to eat food, can just trigger it up.
All right, please, can you quickly differentiate between the peptic and the duodenal ulcer?
Peptic ulcer is general name for all of them.
Okay.
All of them are peptic. Then you now have duodenal, gastric, and esophageal based on where they occur, the site. But all of them are peptic.
And then you will agree with me that sometimes if you meet a doctor, you get them, prescribing a lot of fruits. They tell you eat fruits and all of that.
Yes.
Are we now saying that there are no anti-ulcer fruits? And if there is a phrase like that, like if there is a phrase for anti-ulcer fruits.
Anti-ulcer, like fruits that stop ulcer or...
Yeah. Because sometimes you go to the hospital, you see the doctors prescribing fruits and all of that.
The reason we prescribe fruits is because fruits are good for you.
Okay.
Fruits contain a lot of vitamins and minerals, and they are just good for, they contain antioxidants. They are good for you. In ulcer, they will tell you instead that don't eat acidic fruits. The fruit is good for everybody. If you are diabetic, they'll say don't eat sugary fruits, right? But if you're okay, fruit is the best. Nobody, I don't think anybody will tell you don't eat fruits for any reason. You understand? And there are some fruits that are particularly good for certain ailments, but nobody goes rarely goes into that, delves that deep to that. And okay, to treat ulcer, we are not doing a things. We give you medications.
All right, when you were talking earlier, you stated something like, some of the symptoms of ulcer, you have this peppery sensation, these pains, like you feel pepper. And then you go to some homes, I don't know how to link this up. You go to some homes and you see some women, and then people especially, they like, peppery food.
Yes.
And how do one...
Pepper does not cause ulcer.
Okay.
Pepper worsens it. You understand? It's just like, ulcer is a wound. So you have a wound here. You want to pour pepper inside, you see how it will be. Do you understand?
Yeah.
So it doesn't cause it. If you eat pepper, it doesn't change anything. It doesn't corrode the stomach lining or anything. But when it is existing already, you do not want to eat pepper or spicy food or some certain foods.
Triggers the pain.
It will just worsen it. Yeah. And
Alright.
that is the same thing about the fruits. The fruits will not cause it. It will just, if they're acidic, it will just, worsen it.
Now, can ulcer, I'm tempted to call it stomach wound.
You can.
Okay, like, can this disease or this infection or whatever, is it an infection?
You can call it an infection by H. pylori, but it's actually a disease. That's what
Okay,
it is.
how can it be prevented?
Eat well.
Okay.
Eat at the right time. I tell my patients, eat your breakfast before 8 a.m. Even if it is just tea, even if it is just one slice of bread, eat something before 8 a.m. Eat something before 3 p.m. for lunch, and try to eat your dinner before 9. So if you space it like that, at least if you eat by 9 or 8 and you go to bed by 10, the stomach would have tried to empty some of the foods you've eaten so that you don't have to regurgitate. The food doesn't come back up when you lie down. You understand? So the number one thing is eat right. That's number one. That's prevention. Number two, don't abuse painkillers. There are people that abuse painkillers.
Okay.
So don't abuse painkillers. If it is genetic, well, pray that you don't have it. That it doesn't come to you, just the way hypertension is genetic. If some people in your family have it, pray that it will skip you. Try to reduce stress, right? And what else? I think that's basically it.
All right. And then in case, because sometimes you don't know how it comes, you don't know how you can contract these diseases, and then eventually maybe you get to have ulcer. How can these ulcer be treated?
Treatment of ulcer depends on the cause.
Okay.
If it is caused by those NSAIDs, you stop. And then they give you antacids, they can give you proton pump inhibitors, things like omeprazole to reduce the acid, and that's it. If it is caused by H. pylori, they have to eradicate it, they have to give you antibiotics. So they give you antibiotics like amoxicillin and clarithromycin and all that. They give you antibiotics and they still give you the proton pump inhibitor to, eradicate it. If it is stress, reduce stress. And then the apart from what they call it, the diet, like knowing when to eat, you also have to avoid some food. Like I said, you can't eat pepper. Even if you were Mr. Pepper and Mrs. Pepper before, you have to stop. Like no single pepper in your diet, right? No single pepper at all. There is nothing the human being cannot do. People say, if I don't eat pepper, I'll throw up. It's not true. It's not true.
Like me, sometimes I feel that way. Like maybe if you eat certain food, like especially noodles, when you take noodles
without pepper,
and there is not like
pepperish,
spiced, you feel like you want to throw out or something like that.
After eating your noodle, drink tea.
Okay.
Do something that will prevent the nausea.
Okay.
Because if you don't do that, right? See the thing, ulcer, people take it for granted because they don't know the complications that can arise from it.
Okay.
Just like the way people see malaria, it's not just ordinary malaria. It can kill, and I've seen people die from ulcer, and it's not funny, right? So when people come and they are taking it for granted, like I can't do without pepper, I ask you, can you do without your life? Do you want to someday start bleeding, and we can't control it? Would you prefer that, or you want to enter theater because of ulcer? So it's not a joke, right? So you have to be serious about it.
All right. Having said all of that, what kind of food, apart from pepper, what kind of food should an ulcer patient
it's
avoid?
individual dependent. Some people will come and tell you, when I eat garri, it is worse. Some other people, there is a lie. But generally, don't eat pepper. Don't eat oily foods. Don't eat beans because it contains a lot of gas. I didn't mention bloating as one of the symptoms, but it's also one of the early symptoms. And you know how beans and gas behave. So some people are lactose intolerant. So if they take ulcer, they take milk, it will not start causing all those bloating. Meanwhile, some other people, they tell them take milk when you have. So individual dependent. But pepper and spices, oil, beans, no.
All right, thank you very much, Dr. Karen Oguma, for coming to the studio and teaching us all of this. It's nice having you, and
You're welcome.
And we trust you actually had fun watching all of that, and then now you know what causes ulcer, and ulcer is also a deadly disease and how it should be prevented. Now, until we come your way again, same time, next time, same studio, please keep watching Clearview Television. I remain Rose Audu.